I'm Ezekiel Ramirez, your neighborhood reporter in Brazos County. A fast-spreading fungus known as Candida auris is raising concerns in hospitals across Texas. This fungus poses the biggest risk to patients in long-term care and those with weaker immune systems. I talked with a local health expert at the Brazos County Health District about what's driving this spread and what we can do to stop it.
It's very important to keep each other safe, very important to keep you and your family healthy.
Texas has recently seen a rise in Candida auris, a hospital-spread fungus that's hard to treat and easy to spread.
So this type of fungus, it is not for the general population to be alerted. It is more so found in hospital settings, nursing care facilities.
The Centers for Disease Control and Prevention reported more than 2,800 cases of Candida auris nationwide this year, and a quarter of those have been in Texas. I sat down with Aaliyah Thomas, a local epidemiologist. She tells me this fungus can live on hospital surfaces and can spread through medical equipment.
I make sure I clean everything, wipe everything down between every patient to make sure that we're not transmitting any germs or other extra infections that's not necessary.
If you're touching the doorknobs, if you're at the hospital and you're touching the bedside table, and then we're sharing these different items in the hospitals. So then someone else can touch it and then it can become infected in our body. It gets in our bloodstream.
What kind of impact do you think this makes on our neighbors here in the community, especially the ones that, have regular visits at the hospital or nurses or checkups and such?
For the general public, it's low risk. But again, if you are in the hospital, and it's more the long-term patients that may get this infection.
Thomas tells me prevention starts with awareness, especially among healthcare workers.
I think it's important to educate healthcare workers on infection control, because if the healthcare workers in these facilities can disinfect and sterilize properly, we can see a decrease of this outbreak.
As I mentioned, Candida auris is considered a lower risk to the general public, but local experts still urge neighbors to help keep each other safe and healthy. To learn more about this fungus, you can check out the additional resources that I've attached within this story on our website. Reporting in Brazos County, I'm your neighborhood reporter, Ezekiel Ramirez.